All right, let's go ahead and open up to Daily with Doc. Oh, let me turn that off. Yes. All right. Now, let's open up the doors to Daily with Doc. Hello and welcome. If you are watching us on the internet, anywhere other than being right here in the Zoom room, you are welcome to join us here at Daily with Doc Zoom.com. Made it easy for you. Daily with Doc Zoom.com. We are here most of the time, Monday through Friday from 12 to 12:50 p.m. Pacific time. Just a note for those of you who are joining us usually in the Zoom room live, we will be taking a brief break. We will be running replays out on the different platforms, but we will not have a live Zoom until September 11th. So today's the last day, and then through September 11th, we will resume on September 11th. So thank you so much, everybody, for joining us here on Daily with Doc. I just want to do a shout out to our radio community. Hello and welcome, welcome, welcome that you are joining us here. Thank you, Dave Michaels, for making that happen, and MZ for keeping us on the airways with KSCO and KOMY. We appreciate and love you all. And for those of you who are watching us out on YouTube and Facebook and Rumble and listening to us on Amazon Music or Spotify, or watching us on Twitter, or listening on iHeartRadio or Apple Podcasts or Castbox or Radio Public or Pocket Casts, all of these amazing different platforms that are available for people to plug in. You are in for a treat for about 50 minutes of empowering information that allows you to become more of an authority on your own health and wellness, with information that gives you more tools in your toolbox for making decisions that are based on research, on science, but most importantly, common sense, folks. All of nutrition. It does not have what we need to sustain a healthy life. It was proven by a Senate Bill 264 in the 1930s that said that our soil is depleted and does not have what it needs to sustain life. So if it was depleted then, what do you think is going on now? We must be intentional, and that's what you're going to be hearing today on Daily with Doc. If you are joining us because somebody invited you, make sure that you get back with them. Tell them that you plugged in and that you listened, and let them know what you liked best about the program today. Now, the content of this program is for educational purposes only. It is not meant to take the place of your primary care physician, nor are the products mentioned meant to treat, diagnose, cure any diseases. But folks, when you give your body what it needs in a form that it can use things. So my name is Becca Dukes. As the hostess of this program, it is my great honor to use my testimony and my passion to help people like I was helped by the doctor that we host on this program today, Dr. Joel Wallach. Dr. Wallach has a Bachelor of Science in Agriculture. He's a doctor of veterinary medicine. He has 3 postdoctorates in pathology. And if that was not enough, he wanted to be able to help mankind too, and went on to become a naturopathic physician after teaching nutrition at a naturopathic college. So folks, help me give a very warm welcome to the amazing Dr. Joel Wallach. And Dr. Wallach, before you say anything, folks, if you are here live with us in the Zoom room and you would like to ask Dr. Wallach a question early, I know we didn't get to all the questions yesterday. Dr. Wallach, let's talk about the brain. There's a couple different questions that we've had in the last day or so that have to do with seizure disorders, and then ADHD or ADD, attention deficit disorders. Tell us what you know about those, please.
Okay. Well, the brain is a very interesting compilation of cells and neurons, which are long nerves, go all over the body. and so forth. They carry messages. And if there's some interruption or an excess or a deficiency, things don't work very well. We already discussed Alzheimer's disease, multiple sclerosis, Parkinson's disease, which, by the way, we're really coming on strong with this Parkinson's. We know the cause, prevention, and reversal of it. Okay, I'm excited about what's coming out. FTD, frontal temporal dementia. We have CJD. Let's see here, which is the Creutzfeldt-Jacobs disease, ALS, amyotrophic lateral sclerosis, Lou Gehrig's disease, all these things. And again, today we're going to talk about ADD, attention deficit disorder. They're all related because they all have the same pathology. It's just a matter of dumb luck what part of the brain and spinal cord are impacted. The pathology is the same. Just like when you have arthritis in your knee, it's the same disease as arthritis in your hips. It's the same disease as arthritis in your shoulders. It's the same disease as arthritis in your TMJ, your temporal mandibular joint here. Okay? It's all the same disease. And so, let's take a kid who's in their preteens or in their teens, and this is when ADD really shows up in classrooms and families and so forth. ADD, attention deficit disorder. Number one, they got to get rid of the bad foods that interrupt all these messages, okay? No fried foods, no processed meats, no ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, Spam, hot dogs. That's all got to go because of all the chemicals. If you want salad dressing, use yogurt and or lemon juice, okay? Don't use the oily salad dressing because they interfere badly. And then gluten alert. Wheat brought around oats. There are no such things as gluten-free oats. Gliadin, okay, gliadin is the name of the gluten in oats. They will actually destroy the lining of your intestines. So even if you're taking all the good stuff, if your lining of your intestines are dead, you can't absorb it. It all goes out in the septic tank, okay? And then no buckwheat. There's no gluten in buckwheat, but buckwheat has what's called Fago, F-A-G-O pyrines, which are 10 times worse than gluten. No sugar, no carbonated drinks, even the diet drinks got to go, and also the carbonated water because they neutralize your stomach acids so you cannot absorb minerals or digest food. That's just getting rid of the bad stuff. Then we have Dr. Wallach's Cooking Without the Bad Foods. We got the great book, Dr. Wallach's Cooking Without the Bad Foods, 300 pages of safe recipes and cooking methods, and it has a good food, bad food list in there in bold print. So Dr. Wallach's Cooking Without the Bad Foods. Then per 100 pounds of body weight, not age, but per 100 pounds of body weight, somebody with ADD, attention deficit disorder, they need to be taking per 100 pounds of body weight, 1 healthy brain and heart pack a month. If they weigh 75 to 120 pounds, I'd go with 1 healthy brain and heart pack, do a half a dose twice a day. If they weigh 130 pounds or more, I'd go with 2 healthy brain and heart packs, a full dose of everything twice a day. Then they also need, depending on their body weight, under 100 pounds, they need 1 bottle a month of the MSM, so they can take 6 a day, 2, 2, and 2. If they weigh more than 125 pounds, I go with 2 bottles a month of the MSM, so you take 3 at breakfast, 3 at lunch, and dinner time, okay? And that's going to help, again, when you have osteoporosis of the skull, squeezing the nerves, and all this kind of stuff. And then also the collagen peptides. This took the place of bone broth. When people stopped using bone broth, we came up with collagen peptides. It's collagen and helps you with your bone marrow, your brains, your myelin, the white matter of the brain. Okay, very important here. And then you need what we call I-26. I-26 is the structural material and the biochemical material for your white matter in your brain, to work properly, so you can carry messages and do all the things the brain's supposed to do, and including keep a good attention when you're trying to listen to something, ADD, right? And so you actually need that material, okay? Then we also, in addition to the, let's see here, what else should we throw in there, Rebecca? You know, I like the I-26. What about synaptive? Let's throw some synaptive in there. 1 or 2 of those your age. And they actually help the brain cells and spinal cord cells talk to each other, carry messages to storage, get stuff out of storage, and incorporate the message into whatever function you're trying to do and be attentive and functional and productive. And so with all these nutrients, ADD, I don't care if you've had it for 2, 3, 5, 8, 10 years, it goes away because it's a simple nutritional deficiency. It's not a genetic thing, although doctors like to say it's a genetic thing in families. No, 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 absolutely not. And so, let's see here, Rebecca, did I cover ADD the way you needed? Do we need anything else, or can I go on to the next one?
Right, so there's one more thing that I'd like to add to that, and we have a product called Renew IQ that includes adaptogens that help the brain and everything to function and fire, and where things needs to be up regulated or down regulated. The Q do that, and it's just a powder. You add it to your drink. It tastes good, and it's easy to get kids to drink that, Dr. Wallach. So I would definitely invite people to look at checking out Renew IQ for
To add to
kids.
the system. Yeah, thank you so much. I knew I was missing one of them there. Okay. And the next thing we want to talk about is, let's see here, lupus erythematosus. Lupus erythematosus, doctors want you to believe that it's an autoimmune disease, your body's attacking itself. Absolutely, positively no. Lupus erythematosus is a very simple nutritional deficiency, primarily of connective tissue, the bone marrow, including the skin. Erythematosis, erythema, your skin gets all red like you've been out in the sun too long and getting sunburnt. Okay, but your white blood cells go down, your platelets go down, your red blood cells go down because your bone marrow is going dead. Why is your bone marrow? Like doctors want you to believe, no. Get rid of the gluten, get rid of all the bad foods. No wheat brought around oats, no buckwheat, no sugar, no carbonated drinks. Okay, the diet drinks and also the carbonated water. Stay away from fried foods and oils. And then per 100 pounds body weight, again, you want to take the Healthy Brain and Heart Pack, a full dose twice a day. If you weigh more than 130 pounds, I'd go with 2 Healthy Brain and Heart Packs. You also need the MSM. If you weigh more than 130 pounds, I'd go with 2 bottles of the MSM. You take three times a day to help rebuild the bone marrow. That's one of the things that the MSM does, is rebuild the bone marrow so you can make red blood cells, you can make platelets, you can make white blood cells. And you need the collagen peptides, to scuba that with your morning drink or the evening drink. That's going to help the connective tissue, including the skin. And then I would also, let's see here, throw in the hair, skin, and nails. Doesn't hurt to throw that in. And 3 of those twice a day. It's 2 bottles a month. They're tiny little bottles. Okay. And lupus erythematosus goes away. It's not an autoimmune thing. Your body's not attacking itself. They're going to hospitalize you and put you in a facility and give you all kinds of IV drugs and everything like that. Well, those drugs will actually relieve some of the symptoms, but the disease continues to progress because it's a nutritional deficiency. And the formula I just laid out will actually prevent and reverse a lot of the symptoms and the disease, because it's a simple nutritional deficiency. It's not an autoimmune thing. It's not a genetic thing. Okay, very, very easily dealt with. And how long do you have to stay on the 90 cents nutrients? Well, as long as you want to live. Okay, you look at the Hunzans, their life expectancy is 120. They don't have any medical doctors, but they do have the source of their what should I say, their brain power and their heart power. Okay, and the source, of course, is the land flowing with milk and honey. Okay, no, sheep's milk, goat's milk, no. It's glacial milk. 120, no doctors. We have the best doctors in the world. They can get rid of the symptoms, I mean, in minutes sometimes, certainly hours or days, get rid of the symptoms for you. But the disease keeps progressing. Why is that? Well, because when you're missing something, okay, just relieving the symptoms doesn't solve the problem. And so our life expectancy, depending on whose numbers you're looking at, is 71 to 75. And we have the best doctors, medical doctors in the world. And the people, okay, in the the mountains up there. I'm sorry, the Himalayan mountains. Okay, the
Are you
Hunzans.
talking about Hunzans?
Yeah, the Hunzans. Well, that's the Himalayan mountains. Yeah, the Hunzans in the Himalayan mountains, and they they are getting these nutrients because all this ground up lava up in the mountains is coming down. It looks like milk, so they called it milk. Okay, but it's not cow's milk. It's not the land flowing with milk and honey, but it's glacial milk. Chapter 10 in the book, Rare Earths and Cures, we have an entire book called Rare Earths and Cures that goes into very easily details of why you need to have this. We did 1,700 autopsies of kids in China under the age of 12. And when we came back, we were able to use that information to get rid of cystic fibrosis, supposed to be a terrible genetic disease, birth defect. Got rid of that. We got rid of muscular dystrophy, gave the information to Jerry Lewis. The Muscular Dystrophy Association fired Jerry Lewis, put a gag order on him so he couldn't tell people we found the cure and the cause. And then sort of a side thing that we weren't really looking at real hard was the, let's see here, sudden death syndrome, SIDS. We got rid of that just by putting these nutrients into the baby formulas. And so we're very, very proud of that. Cystic fibrosis, muscular dystrophy, SIDS, and now we're working on Parkinson's disease. We believe we have found the cause for prevention cure. Rebecca just gave me the entire records of this Parkinson's patient, formerly Parkinson's patient. And every time in the first page you open it up to each annual physical, all they're talking about is Parkinson's disease. And then when you get to the end, oh, no more Parkinson's disease, which is 12 years later. Okay, so we're very excited about this. We have a case report written. It's available through the health coaches. Okay, yeah. And so back to you, Rebecca.
All right. Thank you so much, Dr. Wallach, for that valuable information. I know that we have lots of people that have kiddos that, or even adults that are going through life with ADD, attention deficit disorder, or attention hyperactivity deficit disorder, that it's nutritional deficiencies, from what I heard.
That's correct.
So you nourish the body, you nourish the brain, it's nourish the whole entire body because everything's connected and everything works better.
What a concept.
Makes sense. Common sense is what we're talking about here today, folks. So you have to be intentional since it is not in our food. Our food is actually fortified with nutrients, but not the whole battery of nutrients that the body needs. And the soil itself is null and void of the minerals that the plants need in order to provide those minerals to us. Because plants make vitamins, right, Dr. Wallach, and some amino acids.
And amino acids and fatty acids, but they do not make minerals. Plants only need 3 minerals, we need 60. And nutritional minerals do not occur in a uniform blanket around the crust of the earth. They occur in veins like gold and silver.
So then my question to you, Dr. Wallach, because whenever you look at a nutritional panel for any vegetable, it's going to mention minerals. If the plants don't make minerals, how do the minerals get there?
Well, you can put them in there by fertilizer.
Well, no. Okay, so by fertilizer. Okay, go ahead.
Or you have to take them. You have to consciously, proactively take them as a supplement. And, you know, for 3,000 to 5,000 years, every human being in the world had easy access to the same sources of minerals. I'm going to repeat that. For 3,000 to 5,000 years, every human being on Earth, regardless of race or location, what island or what continent they came from, they had equal access to all the minerals. Why is that? Well, because we're using wood and coal as fuel. When you burnt the wood and the coal, we would put the wood ashes and coal ashes into our food as a spice. And wood ashes and coal ashes are 95% minerals and 2 or 3% carbon. And then, let's see here. We also were able to put the wood and coal ashes into the gardens. And they could see very clearly when the yield, in other words, the number and size of the vegetables, carrots and tomatoes and onions and peppers were much bigger and tastier, and the number was greater. So they knew that. But what they did not know was the plants were sucking up those minerals when they were fertilizing with wood ashes and coal ashes. And when you ate the plants that were fertilized with wood ashes and coal ashes, guess what? You got the minerals. Well, when we went to electricity at 3 o'clock in the afternoon, Monday, September 4th, 1882 on Pearl Street, in New York City, in the bluff overlooking a construction at Brooklyn Bridge, suddenly now, 10 hours, got their nutritional minerals taken away from them, and we wound up with all these diseases that doctors are saying are autoimmune and genetic. None of them are. They're just simple nutritional deficiency diseases created by the use of electricity and giving up wood and coal as fuel.
All right. Well, thank you so much, Dr. Wallach, for holding your copy up, because my copy got signed by you and is going to be delivered on my vacation to a brand new distributor. So thank you for holding that up. Folks, plants can't make minerals. If it's not in the soils, it's not in the plant. We have to be intentional through fertilization with non-chemical fertilization. Okay. Minerals, our longevity has Bloomin Minerals, which include all 77 minerals in a granular form that makes it easy to put into your soil that you're growing your food in. For a fact, there are minerals in that soil that are coming up through the roots and then going out into the produce, whether it's the aerial part or the fruit or the vegetable of that plant that you eat. You know that there will be minerals there. So we encourage you to check out the Bloomin Minerals offered by Longevity. You can find that on the website, dailywithdoc.com, or get back with the person that shared this program with you and ask them how you can get a hold of anything that Dr. Wallach mentioned, including the Bloomin Minerals that I mentioned, and make sure that you are being intentional in getting those nutrients into your diet. Well, Dr. Wallach, I have a question in regards to a young man. He is 13 years old, 125 pounds. He is very athletic, but something that teens tend to have to deal with is acne. And what can we do to help this young man?
Okay. You say he's 13?
13, yes.
Yeah. Okay. He needs to get rid of all the bad foods. Okay. No fried foods, no processed meats, no oils, no glutens, no wheat, no butter, rye, oats, no buckwheat, no, let's see here, no sugar, no carbonated drinks. Even the diet drinks and the carbonation need to go. Okay. No carbonation and no carbonated water. And then at 135 pounds, I'd like him, if he's an active athlete, okay, he needs 2 healthy brain and heart packs a month, a full dose thing twice a day, 2 bottles a month of the MSM, so he can take 3 at breakfast, 3 at lunch, 3 at dinner time. Then he needs 2 of those little canisters of the collagen peptides to take a scoop of that his morning drink, scoop of his evening drink, or hair, skin, and nails. He can take 3 of those twice a day, 2 of those small bottles a month. And then lastly, but not the least important, since he's an athlete or active anyway, right? We want him to take our Rebound that has 100 nutrients in it, 75 minerals and 25 vitamins and amino acids. Rebound. We have the sticks, which you take the sticks, cut the top off, put in a bottle of water, 75 minerals and 25 vitamins and amino acids, no carbonation. We have it in the powder, 36 servings in the canister of the powder. And then we also have the cans, 12-ounce cans. But if you're using cans, I suggest you pop the tops on them before you're going to use them, put them in the refrigerator at night. They will off-gas all the carbonation at night in the refrigerator. Then you can drink 1 for breakfast and a half of 1 for lunch and the second half of the second one for the rest of the afternoon. So when I pop the tops, I like to do 2 of them. So I get the Rebound liquid all day from the cans. But remember, the cans are carbonated, so you have to deal with that. Pop the tops the night before you're going to drink them.
Well, and choose the powder, folks. I love the powder myself. His little brother, Dr. Wallach, is 72 pounds, and he is dealing with asthma. He's also very athletic, so the asthma has been slowing him down. What would you recommend for a young man with asthma?
Okay, well, he has to do all the same things that his older brother, 13 years of age, is doing. Okay. And then I would have him take some of our Oxy Body. He could go ahead and take half ounce of that in the morning with his breakfast, half ounce of that in the middle of the day, and half ounce in the evening time. So he's going to go through about a quart and a half of the Oxy Body a month. But he also want him to have, let's see here, it wouldn't hurt for him to have the Rebound also, okay? And I wouldn't take it after 5 o'clock because it'd stay up all night, okay? But but he needs the same stuff that the older brother needs. But since he has asthma, he needs to be sure that he's taking that oxybody, and it wouldn't hurt for him to throw in a cut of the EFAs. He could take.
I'm glad you mentioned that,
sorry?
Dr. Wallach, because in the Brain and Heart Pack, we have two different types of EFAs that are coming from different sources, providing the different omegas and different forms of omega 3, 6s, and 9s. So very important.
Require for function.
Yes, very, very important. Well, Dr. Wallach, let's go to the first hand that is up. And I know Marilyn has a question for a client. Marilyn, go ahead and unmute yourself. You're on live. Unmute. There you go.
There we go. Hi, everybody. Okay, this is regarding, I get this question a lot regarding carbonation. So how, and this is the question people are posing to me. They say, how does hydrochloric acid, which is gastric juice, which is acidic, become more alkaline? Carbonation, which is CO2, and when CO2 is added to water, it creates carbonic acid. So you got two acids. How does that create an alkaline base, reducing stomach acid?
Okay, well, stomach acid neutralizes everything, okay, when it's alkaline, okay? And so you want to be using the, we have, what should I say? We have stomach acid, we have our ultimate enzymes, okay? We have those sort of things. You can take a couple of ultimate enzymes with each meal, okay? But they do have to stay away from carbonation because it neutralizes stomach acid. Okay, that's what it does. It neutralizes stomach acid. You need stomach acid for digestion. You need stomach acid to keep the bugs out of your stomach. And so you have to have stomach acid.
Well, that's what they're wondering is why, how can CO2, when it's added to water, it produces an acid? So how does that make it reduce the stomach acid and make it more alkaline if it's an acid?
Well, I'll ask God how that works.
Oh, okay. Okay.
Just know it works.
Okay, thank you.
All right, thank you, Marilyn. Did you have another question?
No, thank you. It's fine. Perfect.
All right, thank you. And let's go ahead and go to Patty. Patty, go ahead and unmute yourself.
Hi, Dr. Wallach. Hi, everyone.
Hi.
I have two questions. I don't have all the information, but starting with a friend that just had a stroke yesterday. He's in surgery now. He's 52, 53, around there. He is getting a surgery, half of his, or a part of his skull removed on the side. I don't know which side, and I guess they're putting a piece of his stomach. It's the information I have, and leaving it for a month, I think, and then going back and putting the piece of the skull back. What can I do to help him to recovery time and stuff like that? What products do you recommend?
Yeah, how much does this guy weigh?
Oh, he's probably like over 200.
Okay, well, he needs 2 healthy brain and heart packs a month, photos showing twice a day. He needs 2 bottles a month of the MSM, so he can take 3 at breakfast, 3 at lunch, 3 at dinner time to rebuild cartilage and ligaments and tendons, connective tissue, skull, bone marrow, all that kind of stuff gets built with all these nutrients, okay? And then I would also have him take vitamin D3, and I would also have him take the, let's see here, I'd have him take the I-26. It'd take 2 or 3 a day. I like the chewables, but they also come in powder and capsules, okay? That helps rebuild the brain if it's been injured by a stroke. And then don't forget the Ultimate Daily Classic tablets, 3 of those twice a day. There's 2 bottles a month, the Ultimate Daily Classic to support healthy blood flow through blocked arteries and also support healthy blood pressure.
Okay, yes, because he does have, I guess, having high blood pressure is what causes the stroke. Is that correct? What happens?
Well, that's possible. I mean, there's many reasons you get a stroke.
That's what they said. Yeah, that his high blood pressure is what was a problem, and he wasn't.
An abnormal blood clot as a result of that deficiency. That's another possibility.
Okay, thanks, doctor. And then I have a 9-year-old family member. She's she was on medication for 6 months, taking some sort of hypothyroid medication, and the side of eyes and watery eyes and low, just she wasn't responding very well. So what can a little 9-year-old take to help her with her
Well, she needs to get rid of all
hypo?
her
Is it
bad
low?
foods. Needs to get rid of all her bad foods. No fried foods, no processed meats, no oils, no glutens, no wheat, bar, and oats, no sugar, no carbonated drinks. Even the diet drinks and the carbonated water need to go. And then what does she weigh, you think?
She didn't have her weight, but 9-year-old, 40 pounds.
Okay, so let's just say 40 pounds, okay? And so I would have her take one healthy brain and heart pack per month, cut it in half, have her take a half a dose of breakfast and half a dose for dinner time. And then I also want her to have 2 of our Ocean's Gold tablets at breakfast and 2 at dinner time. If we're still back ordered than those, get 2 of the Fucoid Z tablets at breakfast and dinner time. And they're the raw materials that your thyroid needs to make the hormones.
Thank you so much.
You bet. It wouldn't hurt.
Thank-
Give her some of the rebound also.
All right, Dr. Wallach, we have a question coming in from KK. KK is 50 years old, female, 5'6", 147 pounds. Says, my main concern is excessive hair shedding for about the last 20 years. I'm very health conscious and follow most of your food suggestions already. She avoids the wheat and the processed foods, no sodas, no sugars. Any advice that you can share? Thank you.
Well, again, no fried foods, no processed meats, no oils, no glutens, no wheat, no barley, rye, oats, no buckwheat. There's no gluten in buckwheat, but buckwheat has phagopyrenes, which are 10 times worse than gluten. Then no sugar, no carbonated drinks, the diet drinks, and also the carbonated water need to go. And then at 147 pounds, she needs to take 2 healthy brain and heart packs a month, focusing twice them. So you can take 3 at breakfast, 3 at lunch, 3 at dinner time. Then she needs the collagen peptides, 2 of the little canisters, take a scoop at breakfast, scoop at dinner time. And then I also want her to have our, let's see here, I want her to take the, let's see here, for the hair, we want her to take the hair, skin, and nails. She could take 3 doses a day of the hair, skin, and nails. That would be 3 of those 3 times a day. So she'll go through 1.5 to 2 bottles a month of the hair, skin, and nails. Okay, they're little bottles. And this is something that is quite common. People, they tend to eat, I don't eat, she said, she didn't say I don't eat gluten, she said I don't eat wheat. Well, what about buckwheat? What about oats for breakfast every morning? And so that will destroy your intestines, so you cannot absorb the nutrients even if you're supplementing. Okay, it wouldn't hurt. She could also take our liquid plant minerals or plant-derived minerals and take 1/3 of a cup chest or her upper belly and lower belly and have somebody help her rub it 3 times a day, 1/3 of a cup between her shoulder blades, her upper back and her lower back. And she'll absorb those minerals almost like intravenous. And that's going to help her skin make more hair.
So what if it's hormonal, Dr. Wallach? I know that there's hormonal hair loss. What would you recommend for that?
Well, if she wants something for hormones, for ladies, we have the Xerafem. She could take 3 of those twice a day. They're big bottles, so that 1 bottle should last her a month, I think. Okay, of Xerafem, and take 3 of those twice a day. And that's going to give her cells.
That would be overdosing. I apologize to correct you, Dr. Wallach, but only 2 per day on the Xerafem is sufficient.
Okay, well,
Thank
take
you.
it. And so if not having enough girly hormones is involved in her hair loss, and that should help her.
Yeah, if she was heavier than 200 pounds, then absolutely adding additional, but day would be sufficient in helping with hormonal balance. So thank you so much, Dr. Wallach. Let's go to the next hand that is up, and is it Karia or Katria? Go ahead and unmute yourself.
Oh, hi. That was me. That my question was the hair shedding. So I think you called on me twice.
Oh, okay. So
Yeah, my initials are KK.
Okay.
Yeah, my
Name
name is.
here is different. Okay, excellent.
Thank you.
Welcome, thank you. All right, let's go ahead and go over to AJ. AJ, go ahead and unmute yourself.
Hello, Doc. How are you today?
Okay, sir, what you got?
I have a question from Lise on Facebook. An autistic young man, age 31, weight 180 pounds, height 5'9", had a history of seizures as a young child, was seizure-free from age 9 to puberty, had a breakthrough seizure during puberty, seizure-free, had 5 seizures from then till now. The latest was yesterday morning. Had not been on meds. The neurologist prescribed Valtoco. So concerned about autistic young man with seizure issues.
Okay, 180 pounds. Don't go off the medication right away, but at 180 pounds, needs to get rid of all the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, no butter, no oats, no buckwheat, no sugar, no carbonated drinks, even the diet drinks and the carbonated water need to go. And at 180 pounds, 2 healthy brain and heart packs per month, 2 healthy brain and heart packs per month, a full dose of everything twice a day, 2 bottles a month of the MSM, so you take 3 at breakfast, 3 at lunch, 3 at dinner time. Need to have the I-26. I'd have them take 3 doses a day of the I-26. That's going to help them rebuild the myelin, the white matter of the brain, and help the brain cells talk to each other, and the brain cells talk to the spinal cord talk to the brain cells. Also needs the synaptive. Take 3 of those twice a day. It'll be 2 bottles a month of the synaptive. That'll help the brain cells talk to each other. And getting rid of the bad stuff and taking all the stuff that the brain and the white matter of the brain need should solve these problems.
All right, thank you so much, Dr. Wallach.
Thank you,
And
Doc.
You betcha.
let's go right over to a young man on an iPhone. Go ahead and unmute yourself, please.
Hi, can you guys hear me?
Yes.
Yes, sir.
Okay, hi, Dr. Wallach. Hi,
Yes,
Rebecca.
sir.
Good to see you guys again.
You too.
Thanks. I'll just have like a really basic question. If they're good for you, and if they are, what are the best ones, or what's like the best way to cook my food, like meats and just, I don't know, just basic food.
Okay, the best way to cook is roasting, baking, grilling. Okay. Heating oils is very dangerous. They turn into trans fats, which cause cancer, inflammation, all kinds of stuff. You do not want to be eating heated oils. Okay.
Okay.
So, like I say, for salad dressing, you want a creamy salad dressing, use yogurt. If you want something that's a juicy salad dressing, take some fresh lemons and squeeze the juice, sprinkle that on your salad. Okay.
Okay. I only cook on my stovetop though. So you said roasting, and what were the other ones?
Roasting, grilling.
Grilling. Okay. 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 I guess I'll have to change things up when I cook.
It makes a difference how you prepare stuff.
Okay. Okay. And where can I find your cookbook? I know I saw it once at one of your.
Yeah. How can you get
Yeah.
the cookbook, Becca?
drjwallach.com. That's where you want to go to get Dr. Wallach's, all of his books, including the cookbook, drjwallach.com. And
Okay.
just a recommendation, like, so you're cooking on the stove top and you need a little bit of something in that pan, always cook on low temperatures and use butter.
Okay. Cool.
Okay.
Thank you, Rebecca. Thank you, Dr. Wallach. Thanks, guys.
You bet. Keep
Very
in touch.
well. Thank you.
I will. Thank you.
All right, Dr. Wallach. So we have another question. And the question is, how does CM cream in the ear keep ringing from happening in the ear?
Okay. Well, the hearing nerve goes from the ear to the brain, from the brain to the ear. When you put the CM cream in the ear tissue and goes down the length of the nerve to the brain.
So the CM cream does what?
Well, it kind of anesthetizes the inflammation, because when you have ringing in the ears or tinnitus, ringing in the ears, buzzing in the ears, balance problems, this can be caused at any age. And remember, I'm saying at any age, this is not an old age thing. You have osteoporosis of the skull, And usually you'll have one or two things show up at first. You're not going to get all 12 cranial nerves impacted at the same time. And one of the most common early ones is tinnitus, ringing in the ears because of its location and so forth. And you can very quickly, within 15, 20 minutes, you take a Q-tip with some of that CM cream on it, put it down in your ear, put a fingerful of CM cream behind your ear, around your ears, it goes into your scalp. And you can get within, 10, 15 minutes, ringing and buzzing relief for maybe 3 to 5 hours, and that'll start coming back again. Okay. But
Okay.
when you have those symptoms, it's kind of like when you have pain and clicking noise. Okay. You can put CM cream on your knee and the pain and clicking will go away, but you haven't dealt with the problem, which is arthritis, which is a deficiency. Same way with the osteoporosis of the skull.
So what would you recommend for somebody who does have ringing in the ears? The CM cream is kind of like a patch to put on it to help relieve symptoms at the moment. But what
That's
would you
correct.
recommend for somebody to address the underlying causes?
Well, you know the answer to that. Get rid of all the bad foods. Healthy
do
Brain and Heart Pack, 1 per 100 pounds of body weight. MSM, 3 twice a day per 100 pounds of body weight. Collagen peptides. We're rebuilding the bones of the skull here. Okay. And again, I like the I-26, so they get all the stuff that's necessary for the white matter of the brain, which includes the covering of the nerves, the myelin, the white matter of the brain, and spinal cord. And I-26, don't forget the synaptive. You can throw that in, a couple of those twice a day. That'll help the brain to get rid of that osteoporosis of the skull. And the book, it's all in your head. And there's a CD that you and Milan and I made, a CD in the book. It's all in your head. There's a chapter for each of the 12 pairs of cranial nerves. It gives you a list and some of the symptoms of all the different diseases you get when each of those cranial nerves is being squeezed. And then we didn't have enough information on the spinal cord, so we came up with the disc, okay? The CD to go along with it. That's primarily where you find most of the stuff, most of the information on the spinal cord being squeezed by the skull is in that disc, okay? So we have it as a set. So on your head. And so this will help these people with these issues.
All right. And as Dr. Wallach mentioned, there is a CD that goes through this book. And what I did is I went through and I interviewed Dr. Wallach on the different conditions that he has found to have symptoms that are related to osteoporosis of the skull. So think about different conditions. Something that the medical establishment has given it a name based on the person that decided to name it or discover it. All of them have symptoms, and they take a couple different symptoms and then they give it a name, a label, and then they give somebody that label. Well, folks, Dr. Wallach is taking the underlying cause, not just giving you a label, because labels mean nothing. There's so many times, and Dr. Wallach has said it himself, that people get an incorrect or misdiagnoses. Well, when you've got these symptoms and Dr. Wallach has figured out what the underlying cause is, and you correct the underlying cause because it's nutritional, then the symptoms just seem to take care of themselves and you no longer have to carry that label. So if you've ever been given a label, folks, don't accept it. That was something that I had made the mistake of, and I had tried everything, and they had pushed me off to pain management until I found Dr. Wallach. And many things that are listed on the front of this book are symptoms that I had that I no longer have to deal with because I followed his advice, and now I'm able to thrive and enjoy life and look forward to growing old, because I feel younger now at 52 than I did when I was 30 or even 25 for that matter, Dr. Wallach. So I just want to say thank you. thank you for letting me have the opportunity to interview and create that CD that goes along with this book. It's all in your head. Let's go over to AJ with another question, Dr. Wallach.
Hey, Dr. Wallach, me again. We have a question from Rumble by way of Indianapolis, and this is something that you discussed ad nauseum, but it bears repeating for some of us. I know that on the bad food and good foods list, Dr. Wallach has olive oil as not to use, but if you're eating it with a salad, uncooked virgin olive oil, is that okay?
Okay. If you're squeezing the oil out of the olive yourself and using it, that's fine. But if it's in a bottle, it's been sitting on the shelf in the barn for a couple of months in 120 summer degree heat, it's not okay because it turns into trans fats, which cause cancer and inflammation, all kinds of stuff. So you don't know how old that bottle is. It may have an expiration date. Expiration 2030. Well, if it's 2030 and it was made in 2014 and it's been sitting in the barn at 120 degrees, that will kill you. Okay, because it turns those oils into trans fats.
Thank you, Doc.
You bet. Thank you, AJ.
So the question to that, or the answer to that, Doc, olive oil is not okay, because I don't know anybody that has an olive grove next to them, squeezing their own olives to make their own olive oil and have the ability to use it within 3 days.
Yeah,
Unless
some of these fresh food stores do have sticks with little branches on them, and they have the olives still on there. If you can get those, that's chancy, but that's the safest way. You can get the olives that are still on the stick.
It's not giving you oil that people are commonly used to using in their cooking, Dr. Wallach.
Well, they have to make choices, don't they?
They do have to make choices, folks. And I have found that that smell that we are so used to when it comes to olive oil, oh, that's olive oil. Yeah, it's rancid. And the more rancid it is, the stronger the smell is. It's not worth it. Because, Dr. Wallach, what happens when you add oil to your diet? All of that oxidation in the oils.
Well, number one, you're getting a lot of calories in the oil. Okay, number two, when you oxidize oil, it turns into trans fats, which cause inflammation. Okay, if you have anything like arthritis, it'll make it worse. If you have heart disease, it'll make it worse. And then also, trans fats can precipitate different types of cancer.
Wow. So does it contribute to like plaque in the arteries?
It can, yeah, that's it, cause of inflammation, plaque in the arteries. Mm-hmm.
Or even like gallstones?
Yeah, it can contribute to gallstones.
Wow. So there's so many different things, folks, that
Any place that inflammation will be a negative. You take these oils, they're in a bottle, plastic bottle, glass bottle, can, all that kind of stuff. You have no idea how long it's been in there, how it was prepared, under what circumstances, and so it's extremely dangerous.
or how before it got bottled.
There you go.
Yeah. Well, there's so many things, Dr. Wallach, to learn that we've been mistaught. And that's what this program is all about. And that is to give people information that is not what they're going to find on a commercial. As I'm finding, Dr. Wallach, every time I turn on the TV, I'm finding commercials supporting all these different chemicals or all these different artificial foods, even foods that are manufactured in a laboratory now, Dr. Wallach. One of these days, we're going to have to go into that. But
yeah, they're highly suspect.
They're very highly suspect. Dr. Wallach, I know you've got another program to get to, and I don't want to hold you over. We just want to thank you so much for being here with us on Daily with Doc. You are awesome, and we greatly appreciate you, Dr. Wallach.
Well, thank you for the opportunity to participate and be part of the family. God bless you, and God bless all our viewers and listeners and family in the world. And talk to you later. Bye-bye.
All right, bye for now. And if I could get my co-hosts on the screen with me today, I just want to do a quick little shout out for them because they are awesome, amazing, and highly appreciated as well. I would not be able to type like I used to do and put information in the chat like Marilyn does now, and Sherry does now, and AJ does now. And I think Albert's even putting some stuff in there now that just really emphasizes what Dr. Wallach is saying. With Marilyn, it's a little different because she's doing dictation, folks, where she is typing what Dr. Wallach recommends for the individuals and putting it there in a chat. That's one of the biggest advantages of being here with us live in our Zoom, which is dailywithdoczoom.com. We are here from 12 to 12:50 p.m. Monday through Friday, but we are taking a little needed vacation, and it's back September 11th, where we will be coming back on live. And we have Miss Sherry, who is helping to field questions from the different platforms, including here in the Zoom, so that we make sure I don't miss anything, time permitting. And I want to thank you, Sherry, for doing that as well. Albert, for helping make sure everybody gets in on a timely manner, and also watching those cameras to make sure that everything is kosher there too. And then we have our assistant executive production manager, AJ, who is also fielding those questions and also making sure that our streams are going where they're supposed to and staying online. Thank you so much, AJ, for all that you do. You also are greatly appreciated. And folks, all of you have characteristics about you that I know. Let's keep you healthy on a road to wellness that allows you to stick around, able to function with a smile, and not smiling through the pain for many, many years to come. Get with the person that invited you to this program. Tell them thank you for sharing it with you. We covered a lot of different things today. So I know that there is somebody, as you're listening, that you can think of that might be dealing with or living with or coping through one of the symptoms or conditions that we mentioned on today's program. Share it with them. We also have a giveaway that's going on, dwdgiveaway.com, where you can register for our giveaway and get points, different platforms, which will then could possibly land you some prizes, as I will be sending out lots of amazing young products that are offered by Longevity, that Dr. Wallach is the founder of the company. He has detached himself from the company, so he no longer receives a paycheck from them. He wants to be able to come on and share his research and nutritional information with others freely without somebody saying that you're only doing this because you're making a buck. No, Dr. Wallach, he makes his income from his book sales. So we encourage you to go to drjwallach.com and get his books there. That's drjwallach.com. Until next time, my name is Becca Dukes. If you were not referred by somebody specific and you would like to speak with somebody or get your 90 today, you may call us at 3377. That is 855-949-3377, and get a hold of one of our certified holistic health coaches. We also have on our website a contact us option in the menu. It just says contact. Send us an email with your questions and how we can best serve you. And for those of you who want to get started right away and you're not working with somebody, we do have a store there on dailywithdoc.com. Also, you can go ahead and shop the store, and we have replays from past programming in also a search so that you can find different videos or shows that mention specific conditions or concerns. So utilize the website, And don't forget to sign up for our newsletter. That's available to any. Bye for now.